Okay, so I'm here with my patient. What sport do you play?
Hockey.
Hockey. And what position do you play?
Goaltender.
A goaltender. Okay. And which hip is in pain currently?
My left hip.
Your left hip? Okay, so that's this one. So I'm going to start with the non-affected side. I'm doing a FABER test, which is basically the positioning of what your hip is going to be in, which is flexion, abduction, and external rotation. So I'm going to start on the non-affected leg first, and then I'm going to move over to the affected leg just because I want to get a baseline of your range of motion for both hips. So what I'm going to start with, this is testing the anterior ligaments of your hip. So if there's any pain anywhere else, just let me know and we can kind of do different things for that pain, but I'm really just looking at the front of the hip, okay?
Okay.
Okay. And do I have your consent to start my test?
You do.
Okay, cool. So I'm going to bring up the hip into extension, abduction, and external rotation. I'm going to lay into a figure 4. Is that okay?
Yeah.
Okay. Now I'm stabilizing the other side of the pelvis at the ASIS, and I'm just applying a little bit of pressure on the medial aspect of the knee. And do you have any pain there?
Yeah.
Yeah? Where's your pain?
In my thigh.
In your thigh? Okay, so nothing at the front of your hip though?
No.
Okay. So I've gotten a baseline for his pain and range of motion on his non-affected side, and now I'm going to go to his affected side and get more information. So again, flexion, abduction, external rotation. I'm going to put that guy up there. Okay, so we can already tell that this is a decreased range of motion on this side. Not even applying any force, we can tell already. So now, again, I'm stabilizing the ASIS on the other opposite side of the hip and applying pressure on the medial aspect of the knee.
Okay, that's
Any pain? Okay. So this was a positive test because he had pain in his knee and he had decreased range of motion. So I would do further testing to see what is going on in the hip. A negative test would be no pain and the same range of motion. So now what I'm going to be doing is called a hip scouring test. So again, this is your affected side, so I'm going to start on your non-affected side just so that you can see how it feels, and then I can see what the healthy hip feels like. So I'm going to come up. I'm going to apply pressure directly on top of the femur. What I'm trying to do is get that femur into the socket, and I'm rotating it around, trying to feel if there's any pinching, snapping, or discomfort within the acetabulum or the labrum of the hip. So I'm going to be pushing down, creating pressure. Can you feel that?
Yeah.
So I'm going to go into flexion, extension. I'm going into adduction and abduction. And then for external and internal rotation, I'm going to apply some pressure down and then rotate that hip out and in. Does that feel okay?
Yeah.
Okay. So now I'm going to be doing that same thing on the affected side and seeing if there's any pain, pinching, crepitus, anything within that joint that I can feel. So again, bringing the knee into 90 degrees. I'm placing my weight on top of that femur, going into flexion, extension, abduction, and adduction. Any pain?
Just a little bit inside.
Inside, okay. And then I'm going to go into external rotation and internal rotation. There's pain in there too?
External, yeah.
Okay. So he has a positive hip scouring test because there was pain in adduction and external rotation. So again, I would do more testing to find out exactly what his pain would be there. If he had no pain or snapping, crepitus, anything that I can feel within the joint, that would be a negative test.